Welcome or welcome back to my channel. If you are new, welcome. If you are an old subscriber, welcome back to my channel. My name is Lisha Mufa and this is Lisha's Health and Maternity. So I've been receiving emails, people asking me about the benefits of birthing in the home or at the hospital. And I will say that birthing at home is beneficial and birthing in the hospital too is beneficial. It depends on how you want your childbirth to be. You don't necessarily have to choose a particular place of birth just because everyone is doing it. You need to birth at a place where you feel comfortable, where you feel at ease. A lot of women are giving birth at home. It's like I myself was, my mom gave birth to me at home. And then, like, there are so many people who are born in the house. So I will not say that there is something wrong with birthing at home. And we also know the benefits of also birthing in the hospital as well. Hello. Do Rabo Alabayeva. I hope it's an Indian name. Welcome. Okay, so we are going to tackle the home birth first. I'm going live twice. So after I finish the home birth, we go to the hospital birth. So let's see the benefits of birthing at home and the disadvantage. Like everything also have a disadvantage and advantages. So many women opt to birth their babies at home rather than hospital because the surrounding is very familiar. Family and friends can gather together whilst she is birthing the baby at home. However, home births are not ideal for everyone, and there are many things you should consider when contemplating the benefits of home birth versus a hospital birth. Like I said earlier, a lot of people are birthing at home, and they were able to birth at home without any consequence. So, if you want to birth your baby at home, there is nothing wrong with that. And if you also want to birth your baby in the hospital, there is nothing wrong with that. But you cannot just wake up and say, I'm birthing my baby at home. There are so many things that you need to consider before deciding to birth your baby at home. Excuse me, because there may be an emergency whilst you birth your baby at home. And if you are the only person there, you know what may happen. So you need to consider so many things if you are planning to birth your baby at home. Home births are not safe for everyone, like I said. So planned home births are safe for women who are 36 to 42 weeks pregnant, have low risk pregnancies. There should be a certified midwife present if you choose to birth your baby at home. Like I said, you cannot just wake up and say, I'm birthing my baby at home. You need to have a certified midwife around you whilst you birth your baby at home. So as you can see, many of my videos are home births, others are also hospital births. And in every video, I explain the benefits and the disadvantages. Birthing at home is very beautiful, but if you are not required to birth your baby at home, don't birth your baby at home because everyone else is doing it. If you have a low risk pregnancy, if you have a higher risk pregnancy, you cannot birth your baby at home. If you have diabetes, okay, we get that. So before you plan on birthing your baby at home, you need to consult the hospital where you go whilst you are pregnant. The place where you go to antenatal. So you cannot just wake up and say, I'm birthing my baby at home. Gone are the days where our mothers, our grandmothers, they just give birth in the house assisted by just anyone inexperienced. And we know that during those days, there were so many consequences. So now if you want to birth your baby at home, you need to consult the hospital or consult the doctor. And the doctor will be able to see if it's very safe for you to birth your baby at home or if you should birth your baby in the hospital. And when you consult the hospital and you can birth your baby at home safely, they will give you a certified midwife to assist you whilst you birth your baby. Most of my videos are unassisted birth. But let me tell you this, many of the unassisted births that you see on my channel, many of them there will be a midwife there watching the person while she is birthing the baby. But the midwife may not appear in the video. It doesn't mean that there is no midwife there. There is a certified midwife or a certified doula there to assist the person. And the midwife will come to the house with an oxygen in case you need it. So when you see most of my videos on assisted home birth, it doesn't necessarily mean that there is no one there. Hi, I'm Milkan. Welcome. It doesn't mean that there is no one there to assist the person. There is someone sitting there watching whilst she is birthing the baby. So it doesn't necessarily have to be, you just wake up and say, hey, I'm birthing my baby at home. No. You need to consult the hospital. You need to consult your doctor. Let me tell you this. If there is anyone that any person I respect most in my life right now, I think is a doctor. Because I don't know if you have been in a room where someone is undergoing a surgery. You go into a surgery room, then you a theater. Like if you go into a theater, you realize the importance of a doctor. Like, and if you are married to a doctor, I think you should be very, very prayerful with them because it's not easy. I cannot stand in a theater for 5 minutes. I cannot stand it. But a human being will be given in the hands of a doctor to save the person. Like, it's not easy. So let's go to the things that you need to have before you have a home birth. If you are planning to have a home birth, there are so many things that you need to consider before having a home birth. As I said, you need to be 36 to 42 weeks pregnant. And if your pregnancy is a higher risk pregnancy, you cannot birth a baby at home. If your pregnancy is a low risk pregnancy, then yes, you can birth your baby at home. And there should be a certified midwife assisted whilst you are birthing your baby. According to the American College of Obstetricians and Gynecologists, that is the ACOG, you should not consider a home birth if you fall into any of the following categories. 1. If you have a disease that puts you at a higher risk of complications, such as diabetes, high blood pressure, etc. 2. If you are having multiple babies, that is, if you're having twins or more, triplets, quadruplets, or more than that. But I know so many women who gave birth to their twins at home naturally. So it all depends. Like I said, you need to consult your hospital, you need to consult your doctor. Your doctor will be able to know whether you are safe to birth a baby at home. Are you healthy enough? Are you strong enough to birth a baby at home? The doctor will be able to know that. 2 is, if you are 3 is, your baby is breech or any other position that prevents a head first delivery. When we say a baby is breech, like when you're pregnant, the baby's head needs to be down, the pelvis, so that the baby will be born with the head first. So if your baby rather comes with the buttocks, or sometimes the side, it's called breech baby, and it's not easy to give birth to such a baby naturally. Just imagine giving birth to a head first baby. Sorry for using those words. Giving birth to a head first baby through the vagina alone is not easy. So imagine giving birth to a baby who is breech, coming with the buttocks. That is not easy. So in case if your doctor knows that your baby is breech, he will not allow you to birth a baby in the house. But I also know so many women who have given birth to babies at home, a breech baby at home. So it all depends on the condition you are in as a mother whilst you're pregnant. So if you want to have a home birth and your baby is breech, consult your hospital, consult your doctor, and if the doctor says that you are safe to have the baby, of course you can have a home birth. The 4th one is if you've had a C-section. A lot of women after having a C-section wants to have a VBAC, which is vaginal birth after a C-section. And not everyone is healthy enough to have a VBAC. So in case you want to have a VBAC, you need to consult your hospital. You need to consult your doctor, your hospital, And your doctor will be able to know if you are safe to have a VBAC. And if you are not, you won't be allowed to have a home VBAC. And I know so many women too who have also have a VBAC at home safely. So you need to consult your hospital, you need to consult your doctor before you plan a home birth. Don't just get up and say, I am having a home birth. The person you should hire as a midwife when you want to have a home birth. One is hiring a nurse or a midwife who is certified as a good idea. But you need to ensure the midwife works with local obstetrician for consultations and backups. If you want to hire a midwife, don't just hire any ordinary midwife you see. You need to hire a midwife who is certified and works with the local obstetrician and consultations and backups. 2, you can hire a doula who can assist you with labor and provide care to your newborn. I know a lot of people don't even know about doula. I'm really sorry to say this, but many people don't know about doula. A doula is almost like a midwife. But the thing is, a midwife works in the hospital, a doula doesn't work in a hospital. A doula can also assist you to have a home birth. But I think it's best to have both doula and a midwife with you if you are planning to have a home birth. Because a midwife is certified and much more experienced. If you are in America, I know this amazing midwife. Her name is Midwife Angelina. She's on YouTube as well, and she's also on Instagram. If you want to have a home birth, you just need to contact her and she'll be able to assist you. She is certified. Sorry guys, as usual, I'm so hungry. And the next thing you need to consider is where will you give birth? Is it in your home? Like in the home, where actually do you want to give birth? Is it on your bed? Is it on a tub? Or is it in the living room? So, do you prefer to give birth in water or a tub? If this is how you want to give birth, you may need to buy a birthing tub or rent it. Or if you want to give birth on your bed, check if your bed is big enough and comfortable enough to deliver your baby. So these are some of the things that you need to consider if you are planning to give birth at home. Do you want to give birth on the bed? If you want to give birth on the bed, you need to consider, is your bed big enough to be able to deliver your baby? As you can see, when you are in the contractions, when you are screaming and shouting, you may need a bigger space to be able to do that. So is your bed big enough to be able to deliver your baby? You need to consider that factor. And in case you also want to give birth in a tub, you need to have a birthing tub. And if you don't have, excuse me to say this, if you cannot afford a birthing tub, you can also rent it to deliver your baby. The next point is you need to have a plan B if you are planning to have a home birth. This is very, very important. You need to have a plan B if you're planning to have a home birth. Excuse me. So if you're planning to have a baby at home, how most midwives come prepared with oxygen for you and your baby is IV tools for suturing tears and certain medications. You need to have a plan B in place in case there should be a transfer to the hospital to protect your health and your babies. This can happen for many reasons. 1, if the labor is not progressive. 2, fetal distress. 3, high blood pressure. 4, cord prolapse. 5, hemorrhage. 6 is high blood pressure. So if you are, sorry, I already mentioned the high blood pressure. So if you are having a home birth, you need to have a plan B. I uploaded a video, I think last year. I deleted the video, but watch this one. This woman, she wanted to have a home birth. Like she had 4 kids, her 4th baby, she wanted to give birth at home. She labored for 4 days Like she seriously wanted to give birth at home. That's why I'm saying that you shouldn't do it because everyone is doing it. Our home birth is very beautiful. It's so powerful to be able to give birth at home without any complications. It's so powerful to be able to give birth unassisted, deliver your baby by yourself. I mean, it's so encouraging, it's so empowering. I mean, women are so powerful, we are beautiful, and we can do anything. But it doesn't mean that everyone else can also do it. You need to consult the hospital that you are attending, that I want to have a home birth, and they'll be able to tell you if you are healthy enough, if you are in a good position, if you are strong enough to have a home birth. So like I was saying in the video, the woman labored for 4 days. So on the 5th day, she said she couldn't take it anymore. And anytime I watch the video, I feel so uncomfortable. That's why I deleted the video, because my channel is supposed to encourage pregnant women. And when I watch the video, I feel so uneasy. I feel so uncomfortable. Like, she labored for 4 whole days. And then the 5th day, she said she couldn't take it anymore. And then they called for an ambulance. Like, if she hadn't gone to the hospital on the 5th day, something bad would have happened. Like, she arrived at the hospital at the right time. So you don't have to necessarily say that I'm giving birth at home just because everyone else is giving birth. No. If you want to have a home birth and it's not safe for you, you're not healthy enough, you're not in a good position to do that, don't do it. Go and birth your baby in the hospital, because you'll be in a good hand. We will tackle the hospital birth after I finish this, but we are talking about home birth, and we are talking about the advantages and the disadvantages. There are advantages and disadvantages to it. Home birth is very, very beautiful, but if you are not safe enough, if you're not comfortable, if you're not healthy enough, don't try it. So when this woman, like, when you watch the video, like, you'll not be able to watch it. Like, I was so uncomfortable. Like, I had to delete the video. Like, she labored. You could see that this woman was going through pain. So, and there was no midwife. She was only at home. She labored at home with her husband and her kids. So, if at that time, if there was a midwife or a doula, she would have said that no, we need to go to the hospital. I think the midwife or the doula would have taken her to the hospital on the 1st day. She wouldn't have gone through that unnecessary pain. But then she labored for 4 whole days, and then the 5th day she went to the hospital and she delivered her baby at the hospital. So if you are planning to have a home birth is so beautiful. It's so empowering. It's so encouraging. I mean, who doesn't want to feel in her own power to be able to deliver her baby with no complications in a private? No, home birth is very private. What I love most about it is the privacy. To be able, like, the intimacy of home birth, like, to be able to birth your baby with just your husband and your kids. That's so beautiful, right? But then if you are not safe, if you are not healthy enough, don't try it. If you have a higher risk pregnancy, don't try going for a home birth. Go to the hospital where you'll be assisted by professional and certified midwives, doctors, obstetricians, gynecologists. And no, I don't want to say much about hospital birth because we are going to talk about hospital birth, and I don't need to say so much about it right now. So let's end it. We will end it here. So these are the benefits of a home birth. Now we are going to the advantages and the disadvantages of a home birth. Now we are going to hospital birth. So I'll end the live here, then we go back. We go to hospital birth, and after that, I am going to share some secret tips on going on YouTube. I don't want to spend much time here because I don't want to spend much time here. So let's end it here. Thank you guys so much for watching. I believe you are going to watch this whole video and learn so much about it. I love you guys so much. Bye.